Chemokines and cytokines are messages that are exchanged amongst the white blood cells in your body and different tissues in order to assess and correct immune concerns. In many patients who suffer from psychiatric illness, there are cytokine abnormalities, and these abnormalities are thought to be due to potential infections and metabolic disturbances that exist in individuals with neuropsychiatric illness. I saw a paper the other day where they had somewhere in the range of 25 different molecules that they had tested, and they had identified patterns of abnormality associated with bipolar disorder, schizophrenia, and major depression. And these tests could distinguish basically who had which one, which is very interesting for what the future practice of medicine will look like and the future practice of psychiatry will look like. But what question it brings up is, why is it that people with neuropsychiatric disease have immune abnormalities? What is there something about schizophrenia that activates your immune system, or is it the immune system that is responding to an infection that is causing the neuropsychiatric condition? This is not clear. No one has answered that, but I have another talk where I discuss the frequency of infections identified with people who have neuropsychiatric illness, and that it's quite similar to what we see in people with chronic fatigue. And on some level, it is feasible that you could treat these conditions similarly. Of course, that would involve going a step further and trying to associate these abnormalities in the behavior of the white blood cells with actual infection. But if you can make that connection, it certainly would make sense that an individual with neuropsychiatric illness should have a trial on treatment with antiviral or antiparasitic antibiotics, so that we can treat their infections and see if that correlates with them getting better. There are certainly reports out there that such an approach does work for some people.